Great. Well, thank you so much for having me. My name is Heidi Girling. I am a health educator. My pronouns are she, her, and she, her, hers. And I have worked in the clinic here on campus for 21 years as a health educator. And I'm also coordinator of the Office of Wellness and Health Promotion. And we are a department in the clinic. So the reason I wanted to use a PowerPoint, because I think it's really helpful to, when we're on a Zoom, to kind of keep track of where we're going with a presentation. So our clinic is a nationally accredited ambulatory care health facility. That means ambulatory care means you should be able to walk in and walk out. National accreditation, we go through a major inspection process every 3 years. We're coming up on accreditation time this coming spring. So we'll be preparing for that. And all of your ambulatory care clinics should actually have triple AHC accreditation. So it's very important. It's major inspection of everything in the building, of the personnel, of charts, everything. So we have 15 licensed medical providers on site, and those licensed medical providers include medical doctors, nurse practitioners, physician assistants, and doctors of osteopathy. And we provide primary care. So think of us as like a regular primary care clinic, general medical care, coughs, colds, stomach aches, stomach flu, headaches, sprains, stitches, all of your regular stuff. Okay. Also including sexual health as well. So our specialty care includes sports medicine, psychiatry, gender affirming care, and reproductive health. We have a very robust reproductive health care department that provides family pact enrollment, which is a California program that offers free birth control, free STI testing, free STI treatment for those that qualify for the program. We also do birth control, prescriptions. We have a gynecologist on staff that can do the implant in the arm and intrauterine devices as well, and removals of those. We also offer medication abortions here. We started doing that in January of 2023, as did all the CSUs and UCs, and we offer that as an option for students who are pregnant. We have case management. So that means we have several case managers on staff that are available for students to refer to off-campus connections to care, or managing care, or even they might help with doing some counseling until a person can get in with the CAPS counselors or into an off-site therapist. We offer immunizations. So we have a vaccine clinic here. We have a laboratory in-house. We have pharmacy. We have x-ray. Health educators like myself. There's 4 health educators on staff. I mentioned Family Pact earlier. And then we have mind-body wellness programming as well. And that I will give you a little bit more information about. Right now, our student health fee is $75. It's included in your tuition. So you'll pay that in your tuition, and that enables you to use the clinic as many times as you need to during the semester with no co-pays. The only thing that you'll ever pay for are medications and over-the-counter items, which are extremely low cost. For example, like right now, I'm having the worst allergies like ever. And I don't know what's going on. I can buy Claritin. You all can buy Claritin. So can staff and faculty. They can use our over-the-counter products. So we sell Claritin. We sell Allegra. It's about $3 to $4. So it's very, very low cost. Tylenol, 100 Tylenol is $1.50. You can get a dozen condoms for between $4 and $6, depending on the brand that you want. I think the Trojan Magnums are $5.85, something like that. So very low cost, the third of the price of off-campus. And they are the brand names. We sell about 150 items at our pharmacy. So besides the ones that I listed, there are other items like vitamins, sunscreen, Carmex, pregnancy tests, Plan B, is $6. I like to always point that out so that students know that they can come to our pharmacy Monday through Friday between 8 a.m. and 5 p.m. and we sell Plan B for $6. I always recommend that somebody should have it on hand just in case, because it's always Saturday night in the middle of the night when you actually need it. So buy it ahead of time, have it ready. There's no questions asked. You just go to the pharmacy, check off the box that you want to buy that, pay for it, and that's it. So there's no questions, okay? And men and women can buy that as well. So it doesn't matter. You just have to be a student, staff, or faculty. 17 and over, I believe, is the age. Immunizations, that's the other thing that you might have a cost for. And our immunizations, we do all the different types of immunizations like tetanus, diphtheria, pertussis. So that's called Tdap. We have the MMR, which is measles, mumps, rubella. We have Hep A, Hep B. Of course, right now we have flu shots. And you'll see us around campus doing pop-up clinics all over. Today we were down by the kinesiology building and the CPACE building and Outpost. So we were down there for about 3 hours today giving out free flu shots. So we have all kinds of immunizations available. They're not free except for the flu shots. Okay, so flu shots are always free because public health gives them to us for free. We don't make money in this clinic, so everything we charge you is exactly what we paid for it, so it's at cost. Our laboratory, we can do a lot of different tests in-house for free, like pregnancy testing, strep throat cultures, staph infection cultures, complete blood cell counts, urinalyses. Those would all be free. And we're about to get some machines, some new equipment that we're going to be able to do even more tests in-house for free. So that's going to be really exciting. I don't know what those are yet, but let's say that you have something that you need to get analyzed. You need a sample analyzed. Your doctor's ordered, I'm going to use a common one, chlamydia and gonorrhea. Very common STI testing. The cost for that is about $20. Okay, so if you wanted to add on syphilis and HIV, your costs are about $50. Okay, so it's very low cost to get testing done, and we use Quest Diagnostics if it's a test we can't do in-house. So you're talking about an international lab that has negotiated really low prices with us for our students. So we don't bill health insurance. We don't require it, and we don't bill health insurance. So you should have health insurance because actually it's a California state law that you must have, that all California residents must have health insurance. So we don't bill it. It's not something that the CSU wants to get involved with because that just is a huge added cost that's unnecessary for our students to get involved in that. So we don't accept insurance, but you should have it. But that's great, but we don't need it to see you. You just have to be enrolled. So all students are welcome, whether insured or uninsured, it doesn't matter. The student health fee is not a health insurance plan. So I want to make sure that's really clear. Keep your health insurance if you have a plan, okay? Don't get rid of it. And no, we don't offer waivers. So I've had students ask, like, because I have my own health insurance through my parents, why should I pay the student health fee? Well, there's a lot of different reasons. Number one, that student health fee not only supplies all of the medical services that you can receive through here, and I've had a lot of students tell me that it was so much faster and easier to get in with a clinician here than through their own insurance. I'm going to tell you, I have Kaiser. I have an excellent health care through the university. I can never get in to see my own doctor, whereas our students can get in same day here, any day. Monday through Friday, if you walk in or you call, you're going to be able to get in. So as long as it's general primary care or any of our other specialties, you will be seen within the day or within the week. So just know that that's one of the things you pay for is the accessibility and the affordability and the confidentiality. I think that's another key piece here. The other thing that it pays for is some of the therapists that are on campus, the clinical psychologists. So if you receive counseling support here or any of the support groups, that's also what the health fee helps pay for. And it also pays for the health education programming, like free nicotine replacement therapy, free Narcan, and I'll share more about that in just a few minutes. We're open all year long. Okay, so we're open summer break, spring break, fall break, winter break. We're here, just not weekends or major holidays. Monday through Friday, 8 to 5, Wednesdays, 9 to 5. Calling to schedule an appointment is probably your best bet, but walk-ins are always welcome. We do have an after hours nurse advice line. And so let's say it's 7 o'clock, 8 o'clock at night, and you took some ibuprofen. I'm just going to give you an example of a time that I called, had to call my advice line through Kaiser once. I had taken some ibuprofen for a headache. And then a couple hours later, I started like a flu just kicked in. Like I just literally started coming on down with a flu, and I needed to take some NyQuil, and I wasn't sure, can I take ibuprofen with NyQuil? So I was able to call my nurse advice line. That's the kinds of stuff they can do. They can also help you with other problems, like telephone triage is key. Let's say you were having symptoms of food poisoning and you wanted to ask more questions like, okay, I don't know what's going on. Do I need to go to the hospital, or can I self-treat? Maybe you're having symptoms of a stroke and you don't know what's going on and you want to ask. Could call and you could get that information. Or you weren't sure what the problem was. Does that make sense? If you were actually having symptoms of a stroke, we'd say call 911 and get to a hospital immediately. But sometimes people will literally call a nurse advice line first because they have too much to do. Like I had meningitis once and I called my nurse advice line and I had to write a paper for my graduate program, my master's program. And I was like, do I really have to go to the hospital? Are you sure this isn't treatable at home? And no, you need to go to the hospital. So that's the things that it's helpful for, to help talk to a nurse that can help guide you. So we are conveniently located on the corner of Beach Drive and Merriam Way, right across from the nursing building and right across from Hillside College. So the tall brick buildings, Los Alamitos and Los Cerritos dorms. Parking lot G3 is right behind us. We also have 2 or 3 spots now behind our building that are special for student health services patients. So if you're like, I need to see a doctor, I have an appointment and I'm sick and I need to park, like you can park there and then come into the building. Okay, so that is an option for you as well. So making appointments and preparing for a medical visit, we strongly recommend that you call to schedule. You can always walk in, but be prepared with the following info whenever you go to the doctor. Know your allergies, know what medications you're taking, even the details like what is the medication called, how often do you take it, what are the what's the dosage, right? Is it 25 milligrams? Is it 5 milligrams? That's important information. And also overall health history. So surgeries, any other problems that you might have, diagnoses that you need to let them know. We respect our students' right to confidentiality and privacy. This is extremely important to us, and we follow all the federal HIPAA guidelines, and we're all HIPAA certified. If your parent calls us or your guardian calls us and wants to know if you were in their student was in our clinic, we are not going to provide that information. Okay. If you are 18 and over, that is nobody's business but your own. And reproductive health, it's ages 12 and over. So if let's say we have a 17-year-old student, which is common for us to have 17-year-olds using our clinic. If a 17-year-old comes in and they had used our clinic for reproductive health care, absolutely, we follow California rules and regulations there. It is nobody's business but the patient's business. So we do not release that information. So we always tell parents during parent-family orientations to make sure that your child is prepared to manage their own medical care and you've given them this information. They should also, all students should have their health insurance card on them at all times, or at least a picture of it at all times, because of emergencies in case something happens on campus. You never know when you're going to fall off a curb, or I've seen students run into poles because they're looking at their cell phone, or fall off their skateboard, or get hit by a car. Carry your medical information on you. Let's see. I already mentioned all the health insurance. I'm going to tell you a little bit about what my team does, the Office of Wellness and Health Promotion. We focus mostly on these topics here on the left: nutrition, sexual health, tobacco, alcohol use, drug use. So these are areas that are major foci for us. So we offer peer nutrition counseling. It's free. Everything we do here is free in my team. Peer nutrition counseling, that's general nutrition information with a nutrition counselor who is a student who's about to graduate in the dietetics program. They have to serve 2 hours a week here as part of their class requirements, and they're fully trained before they begin the counseling program here. And so what they do is they can talk with students about maybe you're an athlete and you want more help with your diet. Maybe you have weight loss, weight gain, allergy diets. Maybe you're having, like, you're noticing, I think I'm lactose intolerant, or I'm become a vegan and I'm not sure I'm getting enough of the nutrients that I need. That's where they would come in. Now, we also have a registered dietitian on staff, and the registered dietitian sees students who have more medically complex conditions like eating disorders, disordered eating, diabetes, hypertension, high cholesterol, those types of things. We also have a nutrition basics workshop, which is excellent. 1 hour free. It's incredibly informative. Our sexual health program, we do birth control 101 workshops. We do individual sessions for pregnancy options counseling, and also STI or HIV diagnosis counseling. We do smoking or vaping cessation. We do a counseling session to prepare you for your quit date. And we also provide free nicotine replacement therapy, so patches and gum. And then we also have Narcan. So that's not listed on here, but we do Narcan education, and we will basically, it's like a 20-minute appointment, and you'll come in, you'll meet with a health educator. It's very minimal questions, like 3 questions. And then we have you watch like a 7-minute video about how to use Narcan and how to do it when you're in the situation and how to put somebody in a recovery position. And then we give you the free Narcan, and we also give free fentanyl test strips. So we provide both. And so it's really, when I say the 3 questions, is this for you or is it for somebody else? What is your reason that you want to get it? But when very little information is asked of our students about this, we try to keep it as low profile as, unless the student wants to talk, which so far I've seen a lot of students, and so far not a lot of people want to talk about the reasons why. Just it's because they want to have it on hand in case at a party or something like that. We also do a stress less workshop. We have the body positive program, which is a 8-week series for learning to love yourself just as you are. You grow self-compassion, learning to quiet the inner self-critic, and it's for all students. We do yoga for healing. We're going to be restarting that program up. Probably, I'm hoping by March. It's a 6-week program where it's for survivors of trauma and assault. And then mindfulness meditation. I'm actually a mindfulness meditation instructor myself. I also do all of these other programs too, but the meditation is one of my passion projects. And so I teach meditation classes here on campus. I'm teaching one next week on Monday. It is from 12 to 1, and that'll be at the Student Union. You'll find it in the events and orgs tile. If you type in mindfulness or meditation, you'll find my program. It's called Bliss at the Beach, BLISS, Bliss at the Beach. So I have 2 more this semester I'm teaching. So just an offering for students to drop in, do a little gentle chair yoga, some breath work or pranayama, and some meditation. So 45 minutes free, of course. So we always want to make sure students know that they can reach out to find us or talk to us or ask questions. I have an email address here called wellness@csulb.edu, and that's available for any student to email us with questions, concerns. Um, maybe I want to don't know how to navigate something you mentioned in a workshop. I'm happy to answer those questions. I answer that, or my coworkers, we're always on and prepared to answer those questions 5 days a week. Or you could always call the clinic, and that's our number, 985-4771. And follow us on social media. We have a robust presence on Instagram, and it's our handle is CSULB SHS. Feel free to share our things out on your social media, and we would be happy to also share your events as well. So we can do a little cross collaboration. And then this is our team. This is from a few years ago, but people are often surprised at how large our clinic is. We actually have between 60 and 70 employees, and growing all the time. We actually just hired a second psychiatrist, and so it's pretty exciting, and we do a lot of different really important work for our students, and we're very proud to be your provider.